Teft is a patient today. Lots of times when I do cosmetics, I do what I call a mock-up, just like a sculptor would make something in clay, and then when he's ready, he'll bronze it. So we have these, what I call dental putties, but they're like resins. You can shape them on a tooth, just like an artist, and then you can shine a special light that makes the material hard. In Tefta's case, Tefta, look in the mirror. She's looking at what her teeth look like before I started. We had talked about previously about doing veneers or crowns and really reshaping her smile. But before I take a drill in her mouth, I'm going to actually show her how her teeth are going to look. Sometimes we go in the lab and have the lab do what we call a diagnostic model where they do it in wax, but I prefer actually doing it myself on the patient because it gives me information and feedback from the patient of what they like. And then when I send the molds and impressions to the lab, I've actually been involved with hands-on trial and error, and it really helps the outcome of our cases. So Tefta, you were talking before, look in the mirror, about how you didn't like the edges, and she has
I want to close the spaces.
She has space. She has some recession from bone loss, and we're gonna, in her case, probably veneer her teeth. We might do something called zirconium crowns. It's a new way of covering a tooth where we make a thimble with a new white ceramic metal. Then we cover it with porcelain, or we might do a regular veneer or a traditional crown. Right now, from the mock-up, I'm going to get an idea of what will work for Tefta and what she wants. Okay, so Tefta, you wanted whiter teeth, so I'm going to use one of the white shades of resin.
Okay.
So Tefta, you can see the difference in color. This is the resin, and this is your natural tooth. So I think you will look better with whiter teeth. We're going to take this off now, and you can see what your natural tooth, the difference in shape. So this is what we do before we actually take impressions and send them to the lab and start designing the case. Okay, Tefta, so we'll meet you next week and actually start treatment.
Thank you so much. I really like it.